Hello, it's Dr. Gay from First Second MRI, and this is a 67-year-old female who complains of heel pain. She supposedly injured her foot a month or two ago, just had heel pain before that, and now it's worse. And this is an MRI of the ankle on the left here. These two sequences are from an MRI, and this final picture here is an X-ray in the same patient. We can see that the bones are bright, and along the back of the heel here we have a spur from the bottom. We call this an inferior calcaneal spur that attaches to the plantar fascia. Here on the MRI we see the fascia as a dark band coming up to that spur. There's that spur, but you really can't see the fascia on X-ray. There's also a spur back here in the back of the calcaneus. We call this a retrocalcaneal spur rather than an inferior calcaneal spur. And the Achilles tendon comes down here and attaches. So this is a retrocalcaneal spur at the Achilles tendon insertion. And on this MRI, really you can't see the spur very well at all. It's almost invisible, maybe right there, but you can see the Achilles tendon very well coming down here. The Achilles tendon is normal in signal. It's not torn. It's not abnormally bright. So in this T1 weighted view, things look very good. This is a view, though, with fat suppression. And with fat suppression, edema or inflammation will show up as bright. So we see that there is some patchy bright signal in here. This is in Kager's fat pad, the retrocalcaneal fat back here. So this is a little bit of inflammation. Also, there's a little bit of fluid back here just over the top of the calcaneus. Also, maybe a little bump here. And this is fluid or inflammation. We call this retrocalcaneal bursitis. And also we see bright stuff here. This is normal low signal marrow, and this is abnormal bright marrow. So this is irritated or inflamed. And so this is retrocalcaneal bursitis and reactive marrow edema, inflammation in the bone. So this is why she's having heel pain back here. When we see a little bump back here, we think of something called a pump bump is the colloquial term, but it's called a Haglund deformity. And the Haglund deformity can be associated with people who wear high heel shoes, and they are prone to get irritation and inflammation back here. They can form a little bony bump back here. So maybe a mild Haglund deformity back here in this patient with heel pain. And that's it. Thank you very much.